Attention deficit/hyperactivity disorder, ADHD, is a neurodevelopmental disorder that affects children and adults. The disorder is characterized by symptoms of inattention, hyperactivity, and impulsivity that interfere with daily functioning. The prevalence of ADHD is estimated to be around 5 to 7% in children and 2.5% in adults. This podcast aims to provide a comprehensive review of the literature on ADHD in children. The symptoms of ADHD are classified into two categories: inattention and hyperactivity/impulsivity. Children with inattention symptoms may have trouble focusing, completing tasks, and following directions. Hyperactive/impulsive children may have difficulty sitting still, waiting their turn, and controlling their impulses. Children with ADHD may also experience emotional regulation difficulties. There is no single cause of ADHD. Genetic, environmental, and neurobiological factors are all believed to play a role. Studies have identified several genes associated with ADHD, and research suggests that exposure to toxins such as lead may also contribute to the development of the disorder. Abnormalities in the brain's prefrontal cortex, basal ganglia, and cerebellum have also been linked to ADHD. Diagnosis of ADHD involves a comprehensive evaluation of the child's symptoms, medical history, and family history. The child's behavior and functioning in different settings, such as home and school, are also evaluated. Standardized rating scales and checklists are often used to aid in the diagnosis. There are several treatment options for ADHD, including medication, behavioral therapy, and a combination of both. Stimulant medications, such as methylphenidate and amphetamines, are the most commonly prescribed medications for ADHD. Behavioral therapy, such as parent training and classroom interventions, can also be effective in reducing symptoms and improving functioning. A combination of medication and behavioral therapy may be the most effective treatment approach for some children. Children with ADHD often experience academic difficulties, such as poor grades and lower achievement test scores. They may also have problems with social relationships, such as difficulty making and keeping friends. Early diagnosis and treatment can improve academic and social outcomes for children with ADHD. ADHD is often comorbid with other conditions, such as learning disabilities, anxiety disorders, and mood disorders. Addressing comorbid conditions is important in the treatment of ADHD, as it can improve outcomes for the child. The long-term outcomes of ADHD are variable. Some children may outgrow their symptoms, while others may continue to experience difficulties into adulthood. Adults with ADHD may experience challenges in relationships, work, and daily functioning. Early diagnosis and treatment can improve long-term outcomes for children with ADHD. ADHD is a complex neurodevelopmental disorder that affects many children. It is characterized by symptoms of inattention, hyperactivity, and impulsivity that can interfere with daily functioning. A comprehensive evaluation and individualized treatment plan can improve outcomes for children with ADHD. Ongoing research is needed to better understand the causes of ADHD and develop more effective treatments.